There is a reason. Your blood pressure is not going down, and it is not what your doctor told you. You followed the advice. You took the medication. You cut the salt, and still the numbers don't move. That is not random. It means something important is missing. Not a new drug, not a stronger dose, a completely different explanation. And once you see it, you will never look at blood pressure the same way again. He was 74 years old, and he did everything right. Every appointment, every pill, every single instruction. No salt, no shortcuts, no excuses. For 11 years, he followed the system perfectly, but his blood pressure never moved. 160. Again, and again, and again. His doctor had one answer: increase the dose or add another drug. So he asked a different question. What if the problem is not what I'm doing, but what I was never told? That question changed everything. If you've ever felt like you're doing everything right, but nothing is working, type number 1 in the comments, because what you're about to see might explain it. Blood pressure is not just a number. That's the first mistake. What you see on the screen is not the cause. It is the result, a result of multiple forces inside your body, pulling in different directions at the same time. Some push pressure up, inflammation, stiff arteries, stress signals. Others pull it down, relaxation, hydration, nitric oxide. Your medication only targets one side, one mechanism, but your body is running many at once. So even if one is controlled, the others keep pushing back. That's why the number barely changes, not because treatment is wrong, but because it is incomplete. And until you understand that, you will keep trying harder inside a system that was never designed to fix the whole problem. The first mechanism is something most people have never heard of. It's called shear stress, and it happens inside your arteries when blood flows with force. There is one simple way to trigger it: not running, not walking, but squeezing. When you grip something at about 30% effort and hold it, blood flow slows down in that area. Then you release, and suddenly blood rushes back in. That rush creates friction against the artery walls. That friction signals your body to release nitric oxide, the molecule that tells arteries to relax, not just in your hand, everywhere. Studies show this simple method can reduce systolic pressure more reliably than regular cardio. 2-minute squeeze, 1-minute rest. Repeat 4 times, less than 15 minutes. No equipment needed, just a towel. The second mechanism works at a chemical level. Inside your body, there is an enzyme that controls how tight your arteries become. It's called ACE. When it is active, your arteries contract. Pressure goes up. That's why doctors prescribe ACE inhibitors to block it. But there is something almost no one tells you. There is a natural compound that does the same thing. It comes from a red flower, hibiscus, the same plant used to make herbal tea. Inside it are compounds called anthocyanins. They directly block that enzyme, just like the drug, but without one important side effect. Pharmaceutical ACE inhibitors gradually reduce zinc in your body, and zinc is critical for your immune system and healing. Hibiscus does not do that. In clinical trials, a strong daily infusion showed similar results to prescription medication. Not a sweet drink, a concentrated brew, 2 to 3 grams, hot water, 10 minutes. Simple, but powerful. When used correctly, there is a source of nitric oxide most people ignore. It does not come from food or supplements. It comes from your skin, right under the surface. Your body stores a dormant form of nitric oxide, and it stays inactive until sunlight touches it. Not any sunlight. UVA. When UVA light hits your skin, it triggers an instant reaction. That stored compound is converted into active nitric oxide. It enters your bloodstream, and within minutes, your arteries begin to relax. Blood pressure drops, and it stays lower for hours. This has nothing to do with vitamin D. Different pathway, different mechanism, but most people block it completely. They stay indoors, or cover their skin, or use sunscreen all the time. So the system never activates. 20 minutes, midday sun, arms exposed. That is all it takes. Nothing to buy. But for many people, this one habit changes everything. For years, you were told one thing: reduce salt. And you did. You checked labels. You avoided restaurants. You removed it from your meals. But nothing changed, because that advice was only half of the equation. Inside your artery walls, there are tiny pumps. They move sodium out and potassium in. When they work properly, your arteries stay relaxed. But when potassium is too low, those pumps fail. Sodium gets trapped inside the cells. Water follows. The cells swell. The artery wall thickens from the inside, and pressure rises, not because of what you added, but because of what was missing. Cutting salt does not fix that. Restoring potassium does. When potassium is high, the pumps turn back on. Sodium leaves the cell. The swelling goes down. The artery opens again. Foods like avocado, leafy greens, coconut water, not just healthy. They are corrective. And for many people, this is the missing piece. They were never told. There is one substance that can quietly cancel everything you've done so far. Even if you exercise, even if you eat right, even if you follow every step, this one thing can undo it all. It's called uric acid. Most people only associate it with gout, joint pain. But inside your blood, it does something far more dangerous. It interferes with the system that produces nitric oxide, the molecule your arteries need to stay open. When uric acid gets too high, it doesn't just block that system, it reverses it. The enzyme that should produce nitric oxide starts producing a destructive molecule. Instead, one that breaks down any nitric oxide you already have. So no matter what you try, your body is working against you. This is why some people see no results at all. Not because the methods don't work, but because something invisible is canceling them. Lower the uric acid, and suddenly everything else starts working again. This next one sounds too simple. Most people ignore it immediately. Breathing. But this is not relaxation. It is a direct override of your nervous system. Inside your neck, there are sensors monitoring pressure in real time. They constantly signal your brain to adjust your arteries. But under stress, that system gets overridden. Your body stays in a low-level fight-or-flight state. Heart rate stays high. Arteries stay tight. Pressure stays elevated. Now here's what changes everything. There is one specific breathing rate that resets that system. Not faster, not slower. Exactly 6 breaths per minute. 5 seconds in, 5 seconds out. When you breathe, at that rhythm, your diaphragm moves deeply enough to stimulate the vagus nerve. That signal shuts down the stress response. The sensors recalibrate. Your arteries finally relax. And within minutes, the number drops. Not slowly, immediately. The final mechanism is something you do every day. Eating, but not just what you eat, how you eat it. There's a pathway in your body that creates nitric oxide without using your blood. It starts in your mouth, on your tongue. Live specific bacteria, their job is to convert nitrates from food into nitrites, which then become nitric oxide inside your body. But here's the twist. If that step doesn't happen, the entire pathway fails. And most people are blocking it without knowing, either by swallowing too fast or using antibacterial mouthwash that kills those bacteria. Now here's where food matters. One plant contains more nitrates than almost anything else. Arugula, but blending it won't work. Juicing it won't work. You have to chew it slowly, thoroughly, mixing it with saliva. That is the step that activates the system. Miss that, and you miss the entire benefit. 3 months later, everything changed. Not slightly, completely. For years, his numbers stayed around 160. No matter what he did. Now, they were sitting in the 130s consistently. Not one good day, every day. When his doctor saw the results, he paused, looked at the numbers, then looked at him and asked one question. What did you change? He handed over a piece of paper, 7 mechanisms, 7 actions, all written down. The doctor read it slowly, then said something most people never hear. I know all of this. I've just never explained it together like this. Because the system was never built for that conversation. It was built to manage the number, not the cause. And once you see that, you stop chasing just the number and start fixing what creates it.